Welcome to the African Alliance podcast, the BRILLIANT series, brought to you by the BRILLIANT Consortium's Community Engagement and Advocacy workstream. This series introduces you to the scientists, researchers, and community activists driving innovation and social progress across our partner sites. In each episode, we'll hear from those on the front lines, whether they're uncovering groundbreaking scientific discoveries or working to empower communities through grassroots activism. These conversations give you an inside look at how collaboration between science and community is transforming lives, challenging systems, and creating solutions that can change the world. In this episode, I'm speaking to Agness Chitoshi, the Community Liaison Officer for the Center for Infectious Disease Research in Zambia. Introduce yourself and tell us a bit more about your work at CIDRZ. Who is Agness? Where does Agness come from? What's Agness's story? How did Agness end up here?
So my name's Agness Chitoshi, and I'm a Community Liaison Officer with CIDRZ. I've been with CIDRZ for a long time. I think I started working for CIDRZ as far back as 2014, but then I was a research assistant, but I took up the role of Community Liaison Officer. That was in 2018. So part of my primary roles as a Community Liaison Officer is to spearhead recruitment and retention of participants in studies that we run at our study site, and also community engagement as it relates to the studies that we carry out here. So I work hand in hand with the CAB, our Community Advisory Board, in advocacy for studies and for the community, and also work with other community stakeholders to make sure that we educate the community about the clinical trials that are happening at our site.
Can you share a bit more about your specific role in the BRILLIANT Consortium and as part of the BRILLIANT work?
Sure. So as part of BRILLIANT work, it's more or less what I've already explained. So as part, one of my roles will, of course, be to engage the community, advocacy for the community, and also sensitizing the community about what BRILLIANT is all about, what we are doing, and help the community understand what BRILLIANT is all about.
When you were speaking, Agness, you spoke about your long history when it came to specifically recruitment, retention of trial participants, getting communities interested in trials, helping them understand, the science, and really practicing an act of trust, building community trust in the science and the process, and that pathway that hopefully, gets us to solutions to some of the problems many communities face when it comes to their health. But if you look back over the last year, we've seen, even longer than a year ago, we've seen the vaginal microbicide, we've seen the vaginal rings, we've seen long-acting PrEP, now, of course, world headlines, lenacapavir, this two jabs a year, 100% effective. So you've seen all of these developments happening around us. And one thing is really common, and that is the communities largely who make this research possible are not having access to the fruits of the science. They're putting their bodies on the line, they're investing their time, their energy, and they're taking part in clinical research and trials. But increasingly, we're seeing this mix, whether it's pharmaceutical companies or research agencies. We aren't yet in the place, it seems, where we can guarantee communities access to the fruits of the research that we all undertake together. So my question to you is, we even saw this in COVID, Africans who made COVID vaccines possible would, watch and see mainly white folks overseas getting vaccinated. But, by the time America, Canada, had even started vaccinating their animals in the zoos, we had not even vaccinated half of our healthcare workers. So with all of this happening and communities seeing this happen, what is your message to communities? Why should they continue to trust us? Why should they continue hearing the gospel of Agness, hearing Agness telling them about this amazing trial, hearing Agness, really help build their confidence in the process and as in science? Why should they believe any of us? Because right now the evidence is there that they're not getting access to these products. So why should communities continue supporting the research endeavor?
Oh, well, that's a very good question. And that's a question that communities also have time and time again, because they sometimes feel like they're being used as guinea pigs for these trials that are going on. And we keep on telling them to say, oh, no, this trial might not benefit you immediately, but might come and to benefit the people that come after you. But what's exciting right now, why I would say that the community should start believing in us now more, is because of the work that Brilliant is now bringing up in Africa. Things that are being produced in Africa for Africans by Africans. Maybe then the community will have more trust to say these things are not coming from the Western world. These things are being produced by us and they're for us. It's one way of letting the community believe that this is for them because it's being produced by us. Already, it's like you said before, it's been a struggle. It's been quite difficult to have the community believe in us because most of the products, like you say, I mean, they put their lives at line. We use them, but they don't come to them immediately. And we prioritize other communities apart from the people that we're using these things on. So maybe now that these things like Brilliant is coming on board and is talking about producing products for Africans, we'll even advocate more and more for these things to be happening right now. And it will probably bring more trust in the communities that we're working with.
What has been one of your biggest challenges when it comes to recruiting into research and into a trial?
With recruitment, the biggest challenge really is to let the participants understand why they need to do it. Because you are telling them already to say they're just volunteering to enter in this study, and it's a trial. Might not, and might work. So to try and explain that to them has been quite a challenge. And another challenge that we find commonly in our community, all communities are diverse and all communities have different dynamics. But with one of the challenges that we get here is blood draws. They're always attached to Satanism. People just believe they are drawing our blood for Satanism and so on. So it's explaining to them why we need to get those blood draws from them, what's going to happen to their blood when it's taken from them.
That's such a powerful example. I remember back in the day when we were running voluntary medical male circumcision programs, the whole thrust of mis and disinformation was, what are they doing with the tissue that they cut off?
Yeah.
Such a fertile ground for conspiracy theories and mis and disinformation. What's your biggest challenge then in retaining those participants? Where do you see most participants either withdraw or fall off?
We haven't had major reasons why participants can't return. Most of the reasons would be relocation. That's one of the most common challenge that we have with participants is relocation, getting them to come back if they've relocated to a town that is far away. And sometimes they just get tired if the trial is very long. They kind of get tired of coming to the facility and going back. But mostly, I think retention is a struggle when it comes to relocation. Because the trials that we run mostly are on HIV prevention, and you'd have the young girls. We mostly recruit the young girls, and they're mobile. They'll find a job out of town, get married maybe, and move out of town. So to get them to come back to the study sometimes can be a challenge.
And now on the flip side, can you talk to me a bit about your successes in recruitment and your successes in retention? Where have you seen examples of, wow, that was really, really a great job. The recruitment we really outdid ourselves. Can you tell us a time when you were really proud of what you achieved in terms of recruitment?
Well, I think we've done a very good job in recruiting of participants in most of the studies. Let me say in all of the studies that we've run here. I would give an example of a trial that we were running for HIV prevention under HVTN 705. Yeah, so we did a really good job with recruitment of participants. And I would be proud to say our site has a retention rate of above 90% in almost all the studies that we have run. With retention, I always say, even with the staff that are at the site, I say the English say the first impression is usually a lasting impression. So retention starts the minute this participant walks into the CRS, the clinical research site. How you receive this participant, how you relate to this participant, you need to know that all our trials that we are doing are participant-centered. So it should be all about them, treating them well, because all the staff are really trained in how to handle participants, how to treat them when they're on site, and just give them the dignity that is due to them. And I think that's common for everyone, even if you're not a participant. I mean, you just need to be treated with respect for you to feel that you are part of something that you are doing.
And congratulations on that. I think it's something
Thank
that
you.
you would do well on replicating, from even before you start talking. It's the warmth, it's the smile, it's the welcoming. I think it all contributes to trust. And speaking about trust, when the Lancet published a paper during COVID, I think they looked at certainly more than a dozen countries around the world, and they were asking, what's the biggest barrier, to communities accessing or trusting vaccines, and messages around vaccines and research. And it all came down to, they all had one thing in common, and they all said trust. We have to trust the messenger, we have to trust the institution, we have to trust the spokesperson, we have to trust whatever vehicle it is, that's bringing this intervention. But also speaking about trust, with COVID, historically with HIV, of course, with Ebola, with cholera, there's consistent issues around the spread of mis and disinformation. We've seen conspiracy theories, everything from, this is Bill Gates wiping out the African continent. There's microchips in the vaccines, to the vaccines are linked to 5G cell phone towers. We've really seen it all. What are some of the examples that you can share that you have undertaken in your role to counter that mis and disinformation and really give communities peace of mind based on the evidence?
You gave a very good example on Bill Gates, because sometimes even giving a participant an informed consent and seeing that Bill Gates is funding this project sometimes brings out fear in people, because they consider him a vaccine freak, and he's trying to wipe out the African community. But it's helping them understand, or telling them that this is just somebody that's funding. But these vaccines that are being produced by other people. And these vaccines, you need to explain the different phases a vaccine has to go through before it has to be given to a person. So we need to more trust with the communities, to study our communities and also understand how well this information can be disseminated to them. But over the years, because we've been in this community, like the community that I work in, we've been in this community for a very long time. And considering the study site is based at a government institution, at a government hospital. So already that authenticates that these things that they're doing are genuine, because people just trust the Ministry of Health. They trust what the government is doing, and they know that the government wouldn't do something to harm them. So having the research site for us in our community, having the research site at a government institution, at a government facility, has helped us, because the people know we collaborate with the government, because the message you give them is the government allowed us to do this. You tell them that all the phases that all the phases you need to go through before you actually do the trial. Let them know that these other bodies, that these other institutions, the regulatory bodies that look at what we are doing before it actually comes to you. They need to understand that their safety is first, it's paramount.
You know, as much as people have issues, I guess, with provision of healthcare, et cetera, there's certainly power that's attached to the institute. There's a level of credibility that the institution lends our work. So I think that's a really great example. This is the Brilliant series of podcasts, brought to you by the Consortium's Community Engagement and Advocacy Workstream, introducing you to the scientists, researchers, and community activists at the center of HIV vaccine discovery. Today, I'm speaking to Agness Chitoshi, the Community Liaison Officer for the Center for Infectious Disease Research in Zambia. So Agness, when it comes to community engagement, the Community Advisory Board, or CAB, is of course a standing feature across many research institutes and certainly trials. We also know that having a CAB is not the beginning and end of community engagement, but of course these are very, very critical individuals who ensure that the trial is meant to do what it's meant to do, and really to stand in the gap between science and community. Could you describe CIDRZ's approach to CABs? And then could you take us through the mechanics of a community advisory board? Who are these people? Where do they come from? Do they get paid? Can I apply to be a member of a CAB? Could you take us through that walk of a community advisory board?
So for CIDRZ, our Community Advisory Board, are members of the community that live within the community. It can be anyone. It's very diverse. It ranges from faith leaders, political leaders, civil leaders, anyone that lives within that community, who stands between the community and is like a go-between for the community and the study staff. For CIDRZ, anyone who lives in that community and understands the community that we are doing, that we are working in, is free to apply to be a CAB member. So we have a CAB that consists of about 10 members who live within the community from diverse backgrounds, like I've said. And the role of the CAB really is to advise the study staff. We get advice from the CAB concerning the community. Say we want to do a study, we call the CAB, talk to them. This is what we want to do. Do you think it's something that the community would like to do? Is it something that would be acceptable to the community? What challenges do you think we would face if we had to bring this to the community? And if there are such challenges, how best can we mitigate these challenges? So, yeah, that's part of the role that the CAB plays. Of course, they are not the sole people that need to go and do community engagement. Community engagement usually is done by the staff from CIDRZ. We are the ones who go into the community and disseminate the information about the community, of course, with advice from the CAB on how best we can enter the community. They will give us advice on, okay, which places we can go to try and find the type of participants that we are looking for, what sort of message we should take to the community. we try to help us break down the science to the best way that we can communicate to the communities that we work in.
So in terms of CIDRZ, do you have one CAB or do you establish a CAB for each trial?
Each study site has a CAB, has their own CAB. So if CIDRZ has five sites that they work in, each site will have their CAB. And no, they're not study specific. There'll be the CAB for the entire site for any study that is running for that site. And then we have what we call the general CAB, which meets quarterly, every quarter, where we have all the other sub-CABs from all the other sites come together to have these big meetings so that we can share what we are doing.
In your very long history doing this work, could you share with us a moment where you saw the power of a CAB? Has there been a moment where a CAB has materially changed the trajectory of a trial or influenced how the trial operates?
When the protocol is being written, we go through it with the CAB. They give their input on what they think would be best for their community. And for our CAB, I have seen how they've helped us, especially in terms of recruitment. They've been a body that we have really leaned on because they give us a lot of ideas on how we can recruit the specific people that we are looking for. They understand their communities well. They live there because we just come here to work. So they live there and they know how best we can penetrate their communities. And they've been very, very, very instrumental in our recruitment as well as retention of participants because their ideas are really valid.
So the last question from my side, as Brilliant 001 rolls out, and of course, over the next 5 years, we'll be seeing a lot more from the consortium and of course, including some of the CIDRZ sites. What is one thing that you want communities in Zambia to know about the work of the BRILLIANT Consortium?
I would like them to know that this is being done by Africans and it's also for Africans. And I would like them, that's the one message that they need to know. And I think that the communities will really appreciate because of a lot of myths and misconceptions about vaccines that are produced from the Western world. I think the basic message or the simplest message that I would like the community to know is this is being done by Africans. This work is by Africans and for Africans.
Agness Chitoshi is the Community Liaison Officer at the Center for Infectious Disease Research in Zambia, a long and illustrious career in putting communities at the center, ensuring indeed nothing about us without us. And I think with colleagues like Agness in the driving seat in terms of how and when we engage communities in the context of Brilliant, I think the consortium in the Zambian context is in very, very good hands. Agness, it's been such a pleasure talking to you today, and we look forward to working with you over the next 4 years. You've been listening to the African Alliance podcast, the Brilliant series, bringing you these incredible stories of passion, innovation, and change that take us a step closer to an HIV vaccine. We're constantly inspired by the work being done by our guests, and I hope you are too. The work doesn't stop here. There's always more to learn, more to do, and more to connect with. Stay curious, stay engaged, and we'll be back soon with another inspiring episode from pioneering scientific research to impactful community activism. The individuals we feature on this show are not just changing their fields, they're shaping the future. To learn more about the Brilliant Consortium and how you can get involved, visit africanalliance.org.za and follow us on social media. If you've enjoyed today's episode, don't forget to subscribe, rate, and share the podcast so more people can hear these powerful stories.